Previously, I've talked about the increase over recent years, especially the last 20 years, in entitlement among our children. In fact, many people have spoken about it. It's been the cover story in magazines. Entire books have been written about the subject of entitlement. Some people have called this the age of entitlement. It's a very serious problem, like huge, in my opinion, considerably worse than the pandemic that has recently covered the world. Entitled kids become crippled. They're unable to be happy or to function in fulfilling relationships. But now I'm going to take it a step further. We're going to talk about narcissism, even narcissistic personality disorder, and how it begins with the way we teach our children or fail to love and teach them. To be narcissistic simply means to be selfish. We all demonstrate these qualities from time to time. Some people, however, can never stop being selfish. They become so focused on self-serving behaviors that their personality is defined by them. They have narcissistic personality disorder, or for short, because it's such a long name, NPD. Pay close attention to what I'm going to say. In the beginning, I'll briefly describe this common and serious mental health problem, but the real point, the potentially life-saving point, is to help you avoid standing by while your child gradually develops this problem. The individual steps toward this crippling disorder are insidious, often innocent-looking, and so common as to be accepted as normal. Keep listening all the way to the end, and you will discover ample reward for your doing that. Let's talk about characteristics of NPD. NPD is a condition in which there's an inflated sense of self-importance and an extreme occupation with oneself. You already know 20 people who are like this. The acronym NPD, Narcissistic Personality Disorder, the acronym will be used to refer either to the disorder or to the person who has it, only for the sake of brevity. It's because it's so short. Not to dismiss the seriousness of the problem or the pain of the person who's affected. Here are some of the criteria used for making the diagnosis of NPD. People with this disorder have an exaggerated sense of self-importance, have a sense of entitlement, which we talked about just a moment ago, and require constant excessive admiration. They expect to be recognized as superior even without achievements that warrant it. They exaggerate achievements and talents. They're preoccupied with fantasies about success, power, brilliance, beauty, or the perfect partner. They believe they're superior and can only associate with equally special people. They monopolize conversations and belittle or look down on people they perceive as inferior. They expect special favors and unquestioning compliance with their expectations. They take advantage of other people to get what they want. They have an inability or unwillingness to recognize the needs and feelings of others. They're envious of others and believe that others envy them. They behave in an arrogant or haughty way, coming across as conceited, boastful, and pretentious. They insist on having the best of everything, for example, the best car, or the best corner office, whatever. And they pursue primarily selfish goals, no surprise. At the same time, people with NPD have trouble handling anything they perceive remotely as criticism. And on those occasions, they can become impatient or angry when they don't receive special treatment. They have significant interpersonal problems and easily feel slighted. They react with rage or contempt and try to belittle the other person to make themselves appear superior to the person that they believe is criticizing them. They have difficulty regulating emotions and behavior. They experience major problems dealing with stress and adapting to change. They feel depressed and moody because when they fall short of perfection, that just doesn't fit with their self-image. They have secret feelings of insecurity, shame, vulnerability, and humiliation. To put it most briefly and pointedly, people with NPD are motivated only by one word. They have one word in their dictionary. Me. Me, me, me. Well, so what? Why is it important for us to understand NPD? Because the incidence is so high that we all know several people who have it. And until we understand the disorder, these people are very confusing and can cause considerable stress to the people around them. NPD causes problems in every area of life. Personal happiness, impossible. Relationships, doubly impossible. Work, school, financial affairs, and more. People with narcissistic personality disorder are often disappointed and unhappy when they're not given the special favors or admiration they believe they deserve. A fulfilling relationship with a spouse or life partner is completely impossible, since the NPD makes everything about him or her, which makes genuine and loving connection unattainable. Other people might be briefly entertained by a narcissist. In fact, they can be very charming, but not for long. People begin to avoid them diligently. Now, let's talk about the confusion about NPD. Because ironically, many NPDs can be quite charming. They can be the life of the party. They can appear to be quite ingratiating, but always their motivation is to trade their favors, their charms, their time, and more for something they want. It's always about them. This can be especially confusing to people who are dating an NPD, who can be creatively and abundantly giving. After they've gotten married, the partner who got fooled by NPD goes, "But he was so loving in the beginning." No, he was so manipulative in the beginning. And then once the NPD has established a contract with their partner, like marriage, moving in together, for example, the trap snaps shut, and the partner discovers they're in prison, where they're nothing more than an object to serve the NPD. What about treatment? I have worked personally with a great number of people with NPD and with their families. Once the disorder has matured, once they're adults, I have never seen one person with bona fide, no kidding NPD cured of the problem. I haven't. They can learn to manage their demands somewhat, and their families can learn to respond differently to the selfishness of the narcissist, but true cures are virtually unheard of, as I've confirmed by talking to many psychiatrists and psychologists. What's the incidence? In a study of nearly 35,000 adults by the National Institutes of Health, published in the Journal of Clinical Psychiatry, 6.2%, 1 out of 16 people were found to have full-blown NPD, with an incidence of nearly 8% among men and 5% for women. These numbers are overwhelming, especially since most clinicians I've spoken to estimate that the numbers are low. Why is NPD underestimated? Because selfish behavior has become increasingly normalized in our culture. Me, me, me is normal and often even encouraged or praised. What would we do if the incidence of COVID, for example, were 6.2%? We're not even close to that. Or cancer of the lung, or any medical condition. Eradication would become our number one priority. And yet, identification and management of NPD is virtually off the radar. Whoever talks about it, despite the unspeakable cost of NPD to individuals, couples, families, businesses, and more. Now, let's talk about the contribution of parents in developing NPD. NPD is not inherited, which means that it develops over years in response to some combination of circumstances and stimuli. I can state with categorical certainty that NPD is a response to pain, much like all addictive behaviors are. Children who do not have sufficient and consistent real love are in constant emotional pain, which cannot be ignored. They will respond with whatever behaviors minimize or eliminate their pain in the short term. A child who becomes entirely focused on his pain, his needs, his approaches to pain reduction and self-gratification is, by definition, narcissistic, selfish. To be plain, narcissistic personality disorder is a response to the pain of a lifetime of lacking real love. Really. NPD is usually diagnosed in adolescence or early childhood, but the diagnosis, the making of it, is delayed by years because what parent wants to admit that their child is an NPD, has an emotionally, essentially terminal problem? Nor is any child quick to admit that he or she is over the top selfish. Oh, thank you for pointing out my selfishness. I'll change that. No. So even though the diagnosis is made in late adolescence and early adulthood, I've seen NPD completely developed, full-blown by age 12, and I've seen the signs blooming exponentially in children much younger, 4, 5, and 6-year-old kids. Now, recognition. With practice, a full-blown adult NPD can be spotted fairly easily. It's very common amongst politicians, CEOs, entertainers, and in other occupations where NPD is confused with confidence, drive, and passion. That can be exactly what it looks like. If we really want to be serious about reducing the incidence and effect of NPD around us, especially in our own families, we have to recognize how it develops. It's sneaky. It develops by repetition of behaviors that can appear to be so innocent individually. But these behaviors are like the introduction of a fatal virus. 1 or 2 virus particles may be easily eradicated by the immune system without anybody knowing that it even happened. But introduction of a sufficient viral load, a bunch at one time, can cause the beginning of serious symptoms, which can still be treated successfully if identified early and treated aggressively. But if we don't recognize the early virus and we allow it to multiply unhindered, the result can be serious illness and death. And we've all seen that happen. And now it's a bit late to correctly identify the virus, isn't it? When somebody's dead. Following, I'm going to talk about some examples of what NPD does look like in a child and what the early symptoms can look like in a child who's developing narcissistic tendencies. Pay close attention to these because your child does exhibit some of them. Here are some examples. Whining. A certain amount of this is relatively unavoidable as a child makes the transition from pre-verbal crying to speaking. But as quickly as a child can speak, he or she must be required to speak. For more about this, see the Ridiculously Effective Parenting Training, Chapter 0. It's free on the website, realloveparents.com. Another sign, your child hits a sibling. You carefully explain to the hitter how this behavior is not loving. And the child might apologize, especially if you stand there and demand it. But the child's real goal, and you can see it in their face, is to get out of trouble for himself, not to recognize any pain caused to the sibling. And if the hitter is pushed to state that what he did was wrong or selfish, he tends to become resistant, defiant, and even belligerent. NPDs don't admit being wrong. Another, your child fails to keep the rules of the house, which are clear to everybody. You say something about it to the child who doesn't keep the rules, who just shrugs his shoulders. After you being very specific, the child might correct the errant behavior, whether it's cleaning a dish or taking out the trash, but it soon repeats itself, especially if you're not consistent in loving and teaching. Eventually, Words are not enough to change the lack of responsibilities, so you apply a consequence. The child then often ignores the consequence, or most commonly and most insidiously, completes just barely enough of the consequence, like additional work, for example, to avoid further consequences. Why? For himself. But there's no expression of remorse. I'm sorry I did that, or I was no expression of I was irresponsible or I was wrong. Another, your child makes a mistake. You point it out. The immediate response of a child who is developing narcissistic tendencies, before there's even time to think, boom, is to defend himself. He might do this by denying the mistake entirely, or carefully explaining how it wasn't his fault, or how the right way was just impossible. There wasn't enough time, and on it goes. Another, your child engages in a team sport. He's clearly not one of the best players on the team, so either he quits the team, narcissistically responding to I can't be special, and expresses his disinterest in the sport or disgust for the coach or others, or two, comes home and makes exaggerated claims about his successes, especially if you were not in attendance at the events. Another sign, your child is inconvenienced in some way. Perhaps his chair is just minimally bumped during a meal as somebody, makes their way between the chair and the wall. Immediately, he lets out a sigh of disgust, or he's put out, clearly. The real message being, how dare you inconvenience, the narcissist's favorite word, me, the center of the universe. Another sign, your child has to have the best and newest of everything. Top brand clothing, the latest iPhone, the latest shoes, the latest version of a video game, and on and on. And he's insulted at any discussion that would even hint that he doesn't need these things. Oh, yes, anything a narcissist wants, they need, kind of like air. Another example, your child requires constant attention and praise for everything, for every drawing they make, every song they sing, every point they score, and on and on. Now, all children enjoy positive feedback, but budding narcissists persist and interrupt you until they get the praise they want. And what you give them is never enough. The next demand for attention is seconds to minutes away. Another example, your child demands something he sees in the store. He might say he wants it, but the tone is unmistakably demanding. And the demand is proven, it's proven to be a demand, not a request, if you dare to say no. Your refusal is followed by insistent pleading, anger, sulking, and demanding with an entitlement that can actually become scary. Now, another example, and I know this is a lot of examples, but this subject is so important. We have to see how NPD develops. Another example is your child's in a hurry. And as he rushes down the hall, he crushes the toy of a sibling, for example, a common event, or he knocks a sibling down. He simply continues on his way, if he's a developing narcissist, with little or no evidence that he even noticed and certainly didn't care. If he's confronted with his disregard for the feelings or the well-being of the sibling, he exhibits one or more of the following responses. He denies that it happened. I didn't do that, even though he just did it. He blames it on the sibling, who he claims was in the way. He shrugs his shoulders, sighs, and says something like, okay, I'm sorry, but noticeably the feeling of regret is not there. He argues that he couldn't help it. He argues that he was in a big hurry. It was something important, and he didn't see the object or the child. Another sign, your child compares himself to a sibling, consistently pointing out how his performance, skill, or intelligence was superior. Another, your child talks a lot about how he's going to become rich and famous, even though the child shows no evidence of responsibility at home. He'll talk about being in the NBA, for example, even though he can't qualify for the basketball team at his middle school. This isn't some brief fantasy, but a genuine belief in rewards that are vastly disproportionate to his ability, accomplishments, and sense of responsibility. Another, your child consistently belittles the efforts or performances of people he perceives as inferior, which includes pretty much anybody. Another, your child expresses a desire for a particular meal for dinner, even though dinner preparation is finished, or nearly so, and he's incensed if the answer is no, you have to eat what the rest of the family eats. And he'll continue to express that irritation and disgust before, during, and after the meal. They never let go of what they want. Remember, it's me, me, me. Another, your child takes the larger piece of cake or cuts in line for the use of a piece of playground equipment with no regard whatever for what they've taken from anybody else. Another, your child offends a sibling or other child, and you ask the offending child if he can see the effect that he's having on the other person. He actually shrugs his shoulders, he's not pretending, and says, I guess, but really misses the point entirely. There is no empathy. Another, your child doesn't hesitate to ask someone to get him a drink or something to eat if somebody gets up to get something for themselves, but your child never offers to do the same for others. Two more. Next, your child is irritated by the success of other people or dismisses it entirely. And last, and there are many more, this is just a sampling, repetition. Your child asks for a thing, you refuse for whatever reason. I want to stay up till 2 a.m. on a school night. He asks again and again and again, over and over. Why? Because he simply cannot believe that not getting what he demands is even a possibility. Me, me, me. Any one of these behaviors, and I gave quite a few, might be innocent or the result of, stress somewhere else. But we must pay attention to them because they can all easily become patterns of behavior, and those are very difficult to change, even crippling. So what can we do? We, the parents, are most responsible for the existence and growth of narcissistic personality disorder, a condition at least as harmful as any medical disease. What can we do? 1, we can consistently identify selfish behaviors in our children. Just see them. Open our eyes and not accept them as okay. We must be aware or the problem will grow unchecked. It will. 2, we have to love our children unconditionally and teach them, because such a child who feels loved and taught has no reason to behave selfishly in an attempt to diminish his pain. A truly unconditionally loved child who feels it can't become an NPD. We can learn to do this, to love and teach them, by going to realloveparents.com and see the ridiculously effective parenting training. 3, we have to act quickly and consistently, because every second that a child is being selfish without that behavior being addressed registers, every second registers to the child as, well, the behavior's okay. And so they'll continue that behavior. I can't count how many parents have said to me that when they have attempted to correct a selfish behavior, their child has said, but you let me do it before. Children view uncorrected behavior as right behavior. Selfishness is a response to pain. And if it's allowed to continue, selfishness becomes one of the greatest causes of pain. As parents, we must recognize these patterns and do whatever is required to love and teach our children. Sometimes we have to increase the consequences of selfishness to the point that the child unmistakably recognizes that selfishness is just too expensive to continue. We have to do this early, though. In the ridiculously effective parenting training, I've described in detail the process of increasing consequences. Some children require the elimination of every privilege they have before they recognize that they don't want to continue their selfishness. That takes real commitment on the part of a parent. The longer we wait, in terms of in the moment when something selfish happens, as well as the longer we wait in terms of the age of the child, the more difficult it becomes to reverse patterns of selfishness. We can address this problem, which is worsening all over the world. We must address it.